Most Bay Area school districts will no longer have indoor mask mandates after March 11th. The state says it feels like the right time, but some critics, including the teachers union, say it's premature to ditch those face coverings. Dr. Ryan Ribiera joins us now. He's the assistant medical director at Stanford's emergency department. Thanks so much for joining us.
Yeah, thanks for having me.
So what do you think? Is it too soon? Is it safe enough at this time to ditch the masks?
Yeah, well, I'd say the trends are certainly very encouraging. We've seen huge decreases in cases and hospitalizations across the state for the last few weeks, and I think we anticipate that is going to continue. That said, this is certainly a decision that educators need to be, very intimately involved with. Arguably, they're the ones who are most potentially affected by this. And, given that we've been masking and we've been integrating virtual teaching for now coming on 2 years, there's not really a need to rush. Ultimately, I think by the numbers, the decision probably makes sense, but this is going to have to be, I think something that is adapted to the local environment. State numbers are good. There's certainly several counties that are looking very good, but there's other parts of the state where case rates and hospitalizations are going to be a little higher and are going to take a little longer to come down. And I think it's very important for local authorities to work closely with educators in those areas to find the right time to drop these mandates, and to give themselves enough time to prepare so that it's safe for students and for educators.
And now that we're getting to this point, we are seeing that where some of the concern is coming from is that even though those who are not vaccinated are now allowed to not wear their masks indoors as well, for most indoor settings, what do you think about that when it comes to vaccination status and being able to not wear the mask?
Yeah, well, I'd say there's certainly a scientific argument to say that, those who are vaccinated perhaps should have different requirements than those who are not. But I think the fact of the matter is that practically speaking, those kinds of differential requirements are not very enforceable. And I think as we move to a longer term approach to how we deal with COVID, those kinds of, differential rules are just probably not a practical part of a good public health strategy, in my opinion. So, I think obviously I would encourage those who are not yet vaccinated to reconsider for the protection of themselves and for those around them. But I don't know that it makes sense at this point to have differing masking rules based on those criteria.
Okay. So some new studies from health officials in New York show that Pfizer's vaccine for children 5 to 11 years old offers practically no protection against infection. So the study found that it does still prevent serious illness. So why is the protection so much less? Is it just because the dose is smaller than adults? And what would you tell parents who may be hesitant to vaccinate their kids?
Yeah, well, so I'd say there are several things that are going on here. One issue certainly is the fact that the dose for this age group is just a lot smaller. It's about a third the size as it is for older kids. And so I think that's part of the effect that we're seeing. I think the other thing here is that this study out of New York was done at a time that Omicron was surging. And I think we know that across the board, our vaccines were not as effective against Omicron. And so I think that's part of the difference between what we're seeing here versus some of the earlier studies or some of the early studies that were done on different age groups. And then finally, I think as you go down in age, this is an age group that at baseline was less likely to get infected. And so there's frankly just less room for improvement there when it comes to infection rates. And so I think all of these combined probably are why we're seeing this kind of lackluster performance from the vaccine when it comes to infection rates. Now, that said, the fact that it reduces serious infection and hospitalization is still very important. And I think what I would tell parents ultimately is that the risks are still very much outweighed by the benefits here. And I think we're only going to see improved performance for the vaccine across all age groups as time goes on, and we learn how to adapt it to new variants and to tune the doses a little bit better to make sure that we're providing ultimate good performance.
And Dr. Ribiera, the CDC says more than 140 million Americans have contracted COVID-19 by now. So that's about 43% of the country, about 41% here in California. At this stage in the pandemic, do we have a better idea of why some people get infected and others do not?
Yeah, I think we are definitely starting to learn a lot more about the nuances of COVID and why it affects some over others and why it's more severe in some over others. It remains to be the case that behavioral and environmental factors are going to be the biggest influence on whether or not you are infected. So are you avoiding high risk environments? Are you masking when appropriate? That sort of thing. We're slowly starting to understand that there are likely genetic factors that influence, especially whether somebody is going to go on to have a more severe disease course than others. And so I think that is very important. We're still in the early stages of that research, but I think we can look forward to a time when we'll be able to help people understand their risk levels beyond just, the traditional things like, are you immunocompromised or do you have lung disease? So I think that is going to be very helpful as we look to the long-term management of this disease. But I'd say we're still just at the beginnings of this research. We're still kind of trying to get a handle on genetic variants and things like that. COVID has only been with us for about 2 years now, though it's been a long 2 years. So I'd anticipate that over the next year or two, we're going to learn a whole lot more about how people can individually mitigate their risk.
All right, we'll keep learning as we progress out of this pandemic. Dr. Ribiera with Stanford Health Care, thanks so much.
Yeah, thanks so much for having me.